Okay, so with everything going on, we're all making adjustments. And since Dr. Bittner has sent you guys an email, as he sent me an email as far as changes that are going to take place after spring break. So not that not that a lot is going to change with you guys or even with the online students and things. For the most part, your journals are kind of the thing that is a weekly part of this. The difficulty, I think, is just going to be this following the lectures. And unfortunately, I feel like that's going to be more of a challenge for me than it is you. Maybe for you guys too, because of the lack of interaction. But we will make adjustments, work our way through it. So everything is pretty much going to stay the same as it was as far as your assignments. Some of the things I might do to try and incorporate everybody together as far as any type of discussion is to post a discussion question so that you guys with the online students can kind of converse back and forth about a specific topic that I might propose as far as a case study type of deal and things. We're going to go over this case study here in class this evening too, and before I give this to you, we're going to review some things and talk about some different things because of the nature of this case study. Any questions on any of your homework or the assignments? No? I did some kind of researching on the literature part of your assignment and ran into a snag. So my next step is I'm going to go to the library here at school and see if they can help me with some stuff to help out in that process and things. So the snag was I can pull up one of the journals, but I can't access the articles unless I pay a fee.
Oh.
So I was like, I think I'm going to go to the library and see what we can do there and stuff.
Okay.
So it's good to see you guys here. I'm glad you guys are here and enjoying kind of this move from winter to spring and all the different things that are taking place in our world. So as far as making changes with the structure of the lectures and stuff, you guys are going to be watching them. So from my understanding, there can be the fact of it being live and you can type a question or something like that and stuff. If you watch them later, that's fine too and stuff. So I just pray that you guys continue to persevere and make it through to the end. All the adjustments that the school has to do, I feel more like, wow, that's got to be tough on the administration here and stuff. But so before we get started, I'm going to begin with a word of prayer. Father, we thank you for your goodness to us, and we thank you for the opportunity to be here in this classroom and to take the time given to us to study, to learn, and to gain greater knowledge that we might be more equipped to serve you where you would have us to be. I pray you'll be with our time here this evening, and may you be glorified through the discussion. May you be glorified through this class as well. I pray for these students. I just pray your hand of protection upon them. I pray for the administration, the decisions they have to make, just all the logistics revolved around these changes in our world and in our society. But Father, we do thank you for the fact that you are God and that you are in control. And help us, Lord, just to rest upon that, but also to draw strength from that. And we just thank you and praise you for all that you do for us. And we ask it in Jesus' name. Amen.
Amen.
Okay, so before we get into a case study, because I have this, and you can tell it's kind of a lengthy one. It's just one page. And what I'm going to ask you guys to do with this case study is you're going to get together and talk about it. Okay. I know that probably isn't going to be an issue and stuff. So you guys can talk about it and stuff like that. But before we do, let me lay out give you some things as far as, because what I'm going to ask for you to do with this case study is, and I'll just read this last paragraph of what I'm asking you guys to do here. Okay? I want you to provide a diagnosis of this right here, okay? And it's a married couple. I want you to provide a diagnosis and an explanation for that diagnosis. We're going to talk about it. So you guys are going to talk about this together, but we're going to discuss it as a group here. Also, what type of therapeutic approach will you use, and why are you choosing that type of approach? We're going to discuss some of that here before I give this to you. Develop a treatment plan with specific goals. What types of homework will you employ and why? Will you conduct any type of assessment? If so, which one? So I'm going to go over those things with you before we dive into this, okay? So when we think about diagnosing somebody, now, granted, by the laws of the land, in particular the state of Missouri, you cannot make a mental health diagnosis unless you're licensed. But it helps us to understand part of the fact of different diagnoses that are out there. And I did bring, have you ever heard of a DSM-5? Okay, it's a diagnostic and statistical manual for mental disorders. This is basically the premier book, the premier reference for the mental health field. This is published by the American Psychiatric Association, and all of this is different types of mental disorders. Okay, so I'll help you through that process in that regards here tonight, but just to give you an idea of how this is actually broken down when you think about mental disorders, right? And seeing a counselor isn't always a fact of a negative thing, a bad thing. Okay, seeing a counselor can incorporate all kinds of things in our life. For instance, you could see a counselor just to get advice about different things. Okay, you've been using this book right here, or the second marriage book, you've been using this, okay? So if somebody comes to you, whether they're getting married for the first time or it's a second marriage, and they want to talk to you because they know that you guys, number one, are in a Christian college, but when you leave here, you might be in a ministry setting within a church or some other type of organization, or they might know that you have studied counseling. So they might come to you and just simply ask questions, trying to get advice for them. So counseling doesn't always have to be anything that's negative. It could be the fact of trying to search and gain answers for other issues in life. Okay, you can go to a counselor, and we see this a lot too, for trying to understand what your child is struggling with, right? So different reasons why, but here are some of the things, okay? Just read through, not all of them, but just to read through some of these, okay? Neurodevelopmental disorders, schizophrenia spectrum and other psychotic disorders, bipolar and related disorders, depressive disorders, anxiety, obsessive compulsive, trauma, dissociative, somatic symptoms, feeding and eating. So the list continues. So, and each one of these is broken down into different parts to it as well. All right. So this is the go-to thing when you're in the mental health field, the DSM-5, to help you get a greater understanding. All right. Depression. What do you know about depression? How do you know that somebody is depressed?
They might change their eating habits or sleeping habits, like excessive sleeping.
All right. What else?
Exclude themselves from social activities.
Good.
Could be the way they look or even say.
Okay.
So it can be verbal or nonverbal.
Okay. Let's see. Trying to get to it. Because within this, they have criteria for it. So, okay, I've got to go to the index here.
Does it also give you like treatment plans in that book?
No, no treatment plans.
So it just describes the disorder?
Mm-hmm. Yeah. Okay. Okay, so major depressive disorder. So just to give you an idea, it starts right here with the criteria and it comes over to the other page. All right? So when you're talking to somebody with and you think they might be depressed, okay, the first criteria says 5 or more of the following symptoms have been present during the same 2-week period. Okay, so there's some guidelines right there. 5 or more of this, what is about ready to follow in the same 2-week period. And represent a change from previous functioning. At least one of the symptoms is either 1, depressed mood, or 2, loss of interest or pleasure. But you mentioned that, okay? So, they have 9 different things here that are listed, okay? Depressed mood most of the day, nearly every day. That's just part of it. A markedly diminished interest or pleasure in all or almost all activities most day, nearly every day. And then it goes on, significant weight loss. Significant weight loss. They're not on a diet, but they're not eating. Insomnia or hyperinsomnia nearly every day. Psychomotor agitation or retardation nearly every day. Fatigue or loss of energy. Feelings of worthlessness or excessive inappropriate guilt. Diminished ability to think or concentrate or indecisiveness. Recurrent thoughts of death. Those are just the 9 that are listed there under A. Then they've got B and C. And then you can break it down even further. Okay, you can add to it other things. But when you follow through this, it gives diagnostic features for depression. Then it goes into the development of course, and then it also has a prevalence. And then differential diagnosis, and then comorbidity. Okay? Different things. So this is one of the reasons why this has become pretty prominent. It's the 5th edition of it. All right? So that's what I mean by that. Okay, diagnosis. All right, because one of the individuals in this case study, you might be able to figure out really quick. All right. Okay, so when you think about therapeutic approaches, okay, I had that list of 17 names here last week. Did you guys do any looking into that? No? That's okay. Did you pick one?
I have a couple in mind.
Okay, all right. So I'm going to briefly go through, not all of them here for you, but because I'm asking for a therapeutic approach, all right? So when you guys think about working with people, what type of approach are you going to take with them? How are you going to approach working with them? There's a lot to be said with some of these, but I'm just going to give you some for instance here, okay? Last week I mentioned the systemic approach, okay? Looking at it as a system, looking at the family as a system, but also looking at the family on an individual basis as well. The first name was Alfred Adler. He was a founder of individual psychology. All right, he was an understudy, so to speak. He was associated with Sigmund Freud. He didn't like the way Freud was going, so he left and started individual psychology. Nathan Ackerman, the unofficial founder of family therapy, the parent figure of psychodynamic family therapy. What is psychodynamic? Big word, isn't it? Psychodynamic. When you think about psychodynamic, it basically is the fact of covering or incorporating a lot of different psychological approaches to counseling. Okay? It's going to incorporate, let me get here, it's going to incorporate Freud, it's going to incorporate Alfred Adler, Carl Jung, just a lot of different parts of psychology. Psychodynamic is a broader term for all of those. Okay, then you have a behavioral approach. Psychodynamic is considered the first force. The behavioral approach is considered the second force. Then third is the humanistic, and humanistic is going to have Viktor Frankl and existentialism in it, and that's the third force. And marriage and family therapy is considered the fourth force. Just a little bit of psychological history right there. Okay. Murray Bowen. When you think about, he was one of the first ones to do the systemic approach. He has several different things that he is known for. One of them is differentiation of self. Differentiation of self. Or self-autonomy. Differentiation of self. And that's something to keep in mind, not only with family counseling, but that's something to keep in mind when you're doing individual. Because there are times that you might encounter an individual that you're talking to on a one-on-one basis that they don't have that autonomy with themselves. Differentiation of self. He also talks about triangulation. You ever heard of that one? Anybody ever heard of triangulation? Okay, any idea what it means?
Something with a triangle.
Very good. It's very simple, okay? It's basically incorporating three people. And a lot of times with Murray Bowen, what he found in family counseling, and it could go either way, all right? It could go either way. And what I mean by either way is it could be either good or it can be bad. And most of the time in family counseling, it ends up going towards a negative approach, all right? So let's say that, Jesse, you and Taylor are husband and wife, and these are your children, okay? Now, as husbands and wives, I still have yet to meet a husband and wife that they've never fought. There's always going to be a disagreement. There's always going to be a challenge to the marriage and the relationship centered around everything within a home. I mean, everything within a home, everything, sometimes not, maybe that's a little bit exaggerated. A lot of things outside the home too, okay? So you guys are husband and wife, and let's say that, talk about it with as far as your guys' being able to communicate and talk. You know, you're not quite a talker and she likes to talk, okay? And she asks you a question of what's going on, you're like, oh, there's nothing, you know, and you just had a bad day at work and it's just like, you know, no big deal. And she's had a rough day with the kids and everything, and just one thing leads to another, and all of a sudden, I mean, let's say that you guys are teenagers, okay, and all of a sudden it just kind of escalates and just spills from there, okay? Taylor goes to Gigi and says, man, I don't know why your father doesn't talk. You know, I know he's had a rough day, but sometimes if he would just talk. What she has done is triangulate now. But you go to Abigail. Okay? And you start complaining about her to her. So what is going on is the fact that you guys are trying to get people decide for you.
Mm.
Triangulation, it deals with 3, but that's when you're trying to, on a negative side, you're trying to get the child to be on your side against him.
To gain up on someone.
Yeah. Okay. On the benefit part of it is the fact of, hey, can you help me get your father out of this slump? I know that there's things bothering him and stuff. Okay, that can be a good thing. Okay, it could be beneficial. But most of the time it ends up being on a negative part. One gets the other one to pit against the third person. Triangulation. Okay? That was Murray Bowen's primary thing. Okay? Jay Haley, strategic family therapy. He developed ideas relating to power, hierarchy, and strategic interventions, including directive as well as paradoxical technique. Okay? Strategic family therapy, dealing with power and hierarchy, the structure of a family. Okay? When I think about this one, I sometimes think about, and I've run into it, but not that often, but I've run into it when it's one of the spouses has been military or is in the military still. And the military is pretty much, hey, I'm the boss, I tell you what to do, you don't ask questions and stuff. I'm the commander and stuff. So you see that sometimes. So it's a power struggle, there's a hierarchy there, and just conflicts that arise from that. Okay? Any questions so far? All right. Salvador Minuchin was structural family therapy. Structural family therapy. What is the structure of the family? Now, Haley had the strategic, Minuchin has a structure. His theory came around in the 1960s. He based his research, his theory and research with delinquent youths from poor families. The structural family therapy can be briefly described as systemic approach to family interventions that focus on identifying the underlying patterns or rules that regulate or dictate space between people in the relationship. It's a long definition right there. So let's break it down a little bit. Okay. A systemic approach, so you're looking at the system as a whole, the family as a whole. It focuses on identifying the underlying patterns or rules that regulate or dictate the space between people. So it focuses upon basically the unspoken rules, or maybe the spoken rules, and how people are to relate one to another within the family. Sometimes a parental figure might not like a kid asking why. I told you, that doesn't matter. Boom, do it. Type of thing. More of an authoritarian type deal there. Okay? So it focuses on that systemic approach there, identifying the underlying patterns or rules. Okay? Let's see. Solution focus. Okay? Solution focus. Solution focused family therapy focuses specifically on solutions or on what works for the client. This is the one that I said. In. Is that somebody wanting in down there?
Probably.
This is the one last week when I said the miracle question. You guys remember the miracle question? Okay, this is the one that focuses, that comes from that. It uses that. Its whole purpose is the fact of you're looking at the family, you're looking at the individual, you're looking at the system, and what you're trying to do is find that something that's going to work for them. Okay, like for instance, when you think about cognitive behavioral therapy, one of the things about cognitive behavioral therapy, which was developed by Aaron Beck, was the ABC model. okay? The ABC model, which is just simply, really, A, B, C. Activating event, belief system, consequences. So this model in of itself is, here's a model, and it's going to, and it's intended to work for any and everybody. With solution focus, and with this, what DeShazer is propagating is, let's find what works for the individual. Let's find what works for the individual. Let's not take something and say, this will cover it, this will work. Let's find specifically what the individual needs to have in their life. Okay? Any questions?
What was that theory?
ABC model?
ABC model. Okay.
Yeah.
Thank you.
Yep. Let's see. There was another one, and right now, let's see. Okay, here we go. Okay, conjoint family therapy. And this one has several different ones, but Virginia Citri, however you say her name, okay, she was one of the developers of this. And this one's interesting because of two things. Sculpting. And what she has with this, with sculpting, which is family reconstruction. And what you do with sculpting is you have the client and the family, and a lot of times, if you're going to do this, you might want to have that person, that family member, in the office with just you. Okay? Because this can be very tricky, or it could be an eye-opening type of thing. It's kind of like play therapy with children. You guys ever heard of play therapy? It's a very I'm not a play therapist. I have children on my caseload, and I wish I didn't. They're a challenge, okay? But I enjoy it. Okay, with families, with sculpting is you ask a family member, okay, Gigi, I want you to draw the family, sculpt the family for me. And what the idea is she puts it in order as she sees it. Not necessarily dad is the one at the top, not necessarily. It might even be the oldest child is the one that takes dad's place. Okay? So the client takes the family members and puts them how that they see the family. Which that's the challenging part sometimes to other family members and things. It's a fascinating concept. It's an eye-opening concept too and things. Okay. Now, any questions on that? Those are just some ideas with modalities, counseling techniques. All right? Have you ever heard the term eclectic? Okay. I would encourage you guys to think about that term. Eclectic. That's how I approach counseling. All right? Eclectic is basically you incorporate steps from all these different modalities. Okay, I don't hold to one specific. If I was to hold to one specific one, I think I would hold more towards the cognitive behavioral, not necessarily first, but integrative psychotherapy would be the one that I would probably hold to the most. All right, so the next part. A treatment plan. You ever seen a treatment plan? Ever had to write a treatment plan? Okay. Now, if you guys decide to continue your education into the master's level and you're thinking about licensure, you will, if you think about licensure and you get licensed and you go to work for an agency or you start your own practice, and if you go and get Oh, wow, there it went. If you start working with insurance companies, paneled, if you become paneled with insurance companies, they will want a treatment plan. They want to see what your plan, your approach to this is, okay? So, I brought along a treatment plan. I'm just gonna go over some of it with you. It's pretty extensive. It's not my treatment plan, and it's a treatment plan that was written for obsessive compulsive disorder, okay? And when you think about that in of itself, but when, you can have these types of disorders within family counseling. You can have mental disorders within family counseling. Remember last week I said about the fact, and I drew it up here, mom and dad and like 3 or 4 kids, and one of the children had a drug problem. Well, this drug problem was the identified problem. That's the identified problem. But there could have been another problem that was covered up, that this one right here was covering it up. So when you think about working with families, keep in mind that even with individuals, okay? Even with individuals, you could have an individual that has a couple of different disorders. The comorbidity part can be a part of that. For instance, a lot of things that when you read through this right here, there are a lot of things in there that say that you can diagnose this disorder if it's not substance related. Okay, now when you think about it, you're like, wait a second, what are you talking about? Okay, when you hear commercials on TV, the radio, whatever, for a drug, a prescription, and you listen to the possible side effects, that's what that's talking about. Drug related, substance related. Because suicidal thoughts can come from medications as well. So there's a lot of things that you have to think about when you're working with clients. All right? Don't be afraid to ask questions. Let me see what. Probably don't have it. This is a paperwork for intake. Just a generic, okay? It has a name on it, but it's just generic. All right? And when you read through this, it has a place here for medical history. All right? So you want to make sure that you get all these things here as much as possible. It has a place for family history, social history, educational history, occupational history, marital history, substance abuse history, okay, legal or military history, and any additional information as well, right? They're intended to be extensive. It helps you to do your job better, or helps you to get a greater understanding of what is going on with this person, or what could possibly be related here. All right? So, when you're writing a treatment plan, keep in mind what you're doing. First and foremost, you're going to, at the top here, of course, when you're dealing with insurance companies, they're going to want this number. All right? Now let me show you here. Even when it says like this one right here, other specified dissociative disorders. Okay, you see the number? Okay, that's an insurance number. Okay, the insurance companies know what that number represents, because they have access to this too. So, you'll see a number here at the very top, okay? Number right there, then it lists
The
obsessive compulsive disorder,
psychosis.
all right? So the first thing that's here is long-term goals. Now this therapist wrote out 6 long-term goals. Now that long-term, okay, you're looking down the road. And some of these can be accomplished or could be accomplished after therapy ends, okay? The first one is to reduce the frequency, intensity, and duration of OCD. Did you guys know anybody with OCD?
Yeah.
Okay.
Yes.
Okay. Do you mind sharing a little bit about what the person does? I mean, if you don't want to, that's fine.
I mean, they can just get really particular and like almost angry if you mess with the things that they have fixed into a certain way.
Gotcha. Everything has to be in order and everything has a place.
And if you touch it,
Then they're upset.
Yeah.
You're shaking your head in agreement, so pretty much the same?
yeah.
Okay.
Yeah, I mean, what I had heard from before is everything's got to be perfect, and a single thing could just make them lose their minds on
Mhm.
what they're doing wrong or right, and they just want to be perfect.
Right.
So.
Okay. Don't.
One example is like my mom will go into like a room and flip a switch on, but like it has to be a perfect click before she can walk away from the light. So like she'll just go until she like gets it perfectly.
Okay. All right.
Okay.
Okay. Here's one for you. Okay. I've seen it. All right. Somebody goes to the refrigerator, opens the door, gets out what they want, closes the door, walks away, and this turns in a circle, comes back and pushes on the door.
Make sure it's closed.
Make sure it's closed. And if they turn the wrong way, then it messes up. They have to turn a specific direction. All right. So OCD, when you think about it, there's a lot to it. All right. I saw a program dealing with mental disorders, and the therapist was a specialist in dealing with OCD. And the person that came in for therapy spent, I think it was 3 hours in a shower, because they felt like if they didn't spend that much time in the shower, they were not clean.
Oh my word.
And they cleaned themselves to the point where they were literally bleeding. And when they bled, they knew they were clean. So that's some of the far ends of OCD. Okay? Thanks. So when this first long-term goal is reduce the frequency, intensity, and duration of it. So you're looking at that goal right there to actually extend even beyond therapy itself. Okay? The second one, reduce time involved with or interference from OCD. So what this therapist did for that person that spent 3 hours in the shower, okay, was did a taper down thing. Okay, here's an alarm clock. Click, you got this much time. When it goes off, you have to come out of the shower. And this therapist was actually in the house with that person.
Wow, way to be accountable.
And what they did was taper down to where the fact that that person was 20 minutes in the shower. Okay? So, you reduce the time. Okay? Number 3, function daily at a consistent level with minimal interference from OCD. Okay, this thought process, the obsessive thing. Okay, so you're working on that. 4, resolve key life conflicts and the emotional stress that fuels OCD behaviors. There are times, and the interesting thing is sometimes there's unresolved conflicts in a person's life that creates the OCD. Number 5, let go of key thoughts, beliefs, and past life events in order to minimize time free from OCD. Okay. Can you pick up on anything in those last two?
I guess there are roots or choices that trigger it.
There is. Okay, but what else? Now I'm going to ask you guys, okay, we're adults here. And I'm not going to be crude. I will not do that. But I want you to think with somebody from a world that comes to you, from a worldly perspective. When you think about the person that takes a 3-hour shower, what could be one of the reasons why that person takes a 3-hour shower? When you think about a life event. Rape.
Yeah.
Rape. In fact, this person that took the 3-hour shower was a lady. That's why she cleaned herself to the point where she bled, because of the rape. So when I said comorbid things, what is the thing, you got this as an identified problem, but what could possibly, not all the time, okay, keep in mind it's not all the time, but what could possibly be the underlying cause for this right here? And when you find that, so you can deal with this, and once you deal with this, you're going to find that this was the problem that created this. Or you might find that as you start with this, that they might jump to this real quick because it's an unresolved life event that's actually traumatic. And then you can start dealing with this, and once you get that taken care of, then you deal with the other one. Does that make sense? So keep that in mind, okay? Number 6, accept the presence of obsessive thoughts without acting on them and commit to a value-driven life. Okay? We all can have obsessive thoughts, right? You ever walk out of the house, get in your car and think, wait, did I lock the door?
Mm-hmm.
Oh wait, did I turn the coffee pot off? Or whatever. That's an obsessive thought. Okay, so you think about it, it's like, wait, yes, I did, or it's not that big of a deal, boom, and you leave. Of course, now, with locking your house, I might say go back and check it. Okay? Okay, so those are long-term goals. Those are long-term goals. Now, they're not broken down too much, but the short-term goals are the ones that you're going to break down. All right? So, they have 8 short-term goals. We're not going to go through all these. Just going to give you an idea, okay? So, short-term, goal number 1. All right? Describe the history and the nature of the OCD. You're asking the client to do this. Okay, you're asking the client to do this. So the intervention is, number 1, establish rapport with the patient, with the client, towards building a therapeutic relationship. Now, key, that's very, very important to establish rapport. If not, you won't have a second visit. All right, you really won't have a second visit and things. So work on establishing rapport. Number 2 under the intervention is assess the frequency, intensity, duration, and history of the patient's OCD. So then once you've worked on that, then you have the accomplishment of it. It's accomplished. All right? So you list out the fact of accomplished. And then goal number 2, short-term goal 2. Now this can be important, and that's one reason why with medical history in here, okay? Because in this one right here, it says complete a medical evaluation to rule out medical or substance-related causes for anxiety symptoms. Okay, you might have to ask your client, hey, who's your physician? Schedule for a checkup. What kind of medications you taking? Now, I'm not that great with medications and stuff, so I can Google all that things and find out. and stuff, but you might want to tell your client, let's schedule an appointment with your doctor. Before we proceed, and unfortunately, it might be a month before they can actually get in to see their doctor, but you can still continue to work with them, anticipating the results of that. Okay? You also, as you recommend the medical examination, a checkup and stuff, you can assist the client in following up on the recommendations, including medications, lab work, or specialty assessments. You're going to have to ask your clients, are you being med compliant? All right. Sometimes they might say to you, which could end up being on a regular basis depending upon where you're working at, I don't like how I feel with this medication. Okay, describe what it does to you. Okay, tell me what it does to you. And they will describe it. And you could look at them and say, have you talked to your doctor? A lot of times when you call the doctor, you're going to get a nurse practitioner or somebody in the office to kind of help with the fact of the medication. If it is not working with them very well and it's creating other physical problems with them, by all means, encourage them to follow up. Encourage them to follow up. Sometimes clients will do their own medical diagnosis and think, this medicine's not helping, I'm just going to quit taking it. Right? And the doctor doesn't know that they've quit taking it. And things. So you might have to encourage them in that process. Hey, are you being med compliant? I don't like what it does. Have you talked to your doctor? You need to talk to your doctor. And if you do your research on the medication, you might have information for them. It's like, or you might even ask them, so what's the side effects that it's doing for you? Okay, well, I've done my own research, and yes, it does do that, So talk to the doctor. Maybe you can cut the pill in half. And a lot of times they do have pills that have that little line in them, and you can get a pill cutter and cut the pill. Okay, so different things. Okay, any questions on a treatment plan? All right, now, just as a encouragement here, all right, I'm not expecting perfection here tonight, okay? All right, writing treatment plans is challenging. Here's something to keep in mind too, all right? I'll do it here in a minute. A lot of with our technology today, it's wonderful. It's wonderful. A lot of computer programs that the mental health profession has available to them have things that you can actually go in and type in the mental disorder. It'll pop up a treatment plan for you. And the insurance companies accept it. So it's really kind of cool and things. So, all right. No questions on that? Okay. When I ask the question, what type of homework or types of homework will you employ and why? There could always be different things that you can do as far as homework assignments. And the reason for homework assignments is you're trying to involve the client in the recovery process away from the office. Away from the office. Okay? When I wrote up the ABC model, I probably, let's see, did I? Okay. This is kind of a map that draws out a kind of like the ABC itself. All right, so what you have is, let's just go to here. This box right here says the problem, the activating event in this right here. So there's an event that takes place in the person's life. that activating event is going to trigger the B part, the belief system that that individual has, all right? Which always, most of the time, it's going to generate a stress factor, okay? It's the belief system, the activating event triggers the belief, all right? Like, for instance, you prepare and you study for a final and you get a terrible grade on it. And you think, I'm a loser. I'm not that good. So you start labeling yourself, okay? And the more that you stay there, you're developing a belief system in the fact that you're not capable of doing good in school. So you start to develop stress because of that belief. So next time when a test comes, you're automatically going to stress out because you have this activating event. Oh, it's a test. Oh, great. I know that I'm not going to do well. So that activating event, the test, created your thought process, the belief system that you're not going to be doing good because you're not a great student because you bombed on one test. So it creates stress, all right? So your core belief, your automatic thoughts and everything start to trigger all that once again, okay? So what it ends up doing is you can have the rational adaptive thoughts or the irrational maladaptive thoughts in regards to this right here, the activating event and things. So what you're going to have a client do to get them involved in it is you can give them a piece of paper, and this isn't the piece of paper, but you can give them a piece of paper that has the different things for them. And you can say, okay, if you're dealing with somebody struggling with depression, okay, their depression can be centered on the fact of their thoughts, their maladaptive thoughts. So you give them a piece of paper and say, this is the homework I want you to do. As you notice, and you start to explain it, and everything. Take this home, and when the event happens or when the thoughts start to enter your mind, write it down. Write it down. Just follow this out and write it down and everything. So that's how you're getting the person involved in the recovery process away from the office. You're giving them things to do. Okay, you could also employ journaling. You can also employ reading. Okay, give them material to read and things. You can give them, it's like, look, this is a short book. Let me do it this way. This is a short book. Oh, by the way, read it.
Mm-hmm.
Okay, it's good. I like it. Okay, you might have a client coming in that's going through grief. They've suffered a loss of a loved one, and you're working with them through the grief process, and you say, hey, I want you to start reading this book. But what I want you to do, okay, for this week, I want you to read like chapters 1 and 2. Okay, write down your thoughts, and here's the piece of paper and stuff like that. Just write it down. Tell me what's going on when you through the week and stuff. So they bring that back, and you've read the chapters yourself. You've prepared as well. They bring back their homework, and you're able to help them work through. Okay, so you can give them material to read as well. Okay, the next thing. Any questions on that? No? Okay. So, assessments. What types of assessments? And I don't think I brought it. I've been lucky. I've been pulling all this out, so. Nope. Okay. There are different types of assessments that are free. They're in the public domain. You can do a depression inventory. You can do an anxiety inventory. There are obsessive compulsive inventories that you can incorporate if that's what you're dealing with. There's a lot of information as far as grief because that one book has grief on it and stuff, right? So, and by the way, we'll talk about grief in this class too. So, different types of assessments. Which one would you use? Now, with this right here, even though I asked it, I'm going to let you guys come up with some of the answers to this. All right? Let's take a break.
You're in the motion class, right? Oh, yeah.
Yeah, I thought that.
Right?